Mental health services have a strong history of service user involvement. Patient Opinion website can offer a new, exciting and innovative way for this to happen. People can feedback their experiences of care and treatment in a safe way. This can offer real-time feedback to staff who can listen and respond online to those experiences. This will help staff to improve services and also celebrate good practice. You may be thinking, is this going to be too much work? How's it helped me? And why is patient opinion different? Well, patient opinion, understandably, is a little different for staff. But actually, listening to feedback is a part of their job anyway. And in fact, the technology makes this process very, very easy. An email alert goes to just the right people in your trust once a posting has been received. And then the trust can decide how they want to respond to that posting online.
Thanks so much.
No problem.
Cheers.
Right, bye-bye.
It doesn't have to be difficult. My development plan is probably 2 sheets of A4, and it just states, you know, what we're going to do, when are we going to do it by, and how we're going to measure it, and what is success. So very simple and straightforward.
This is a quick, easy way for people to feedback what they think, and it's also a quick and easy way for us to demonstrate that we're acting on that feedback.
Our work with mental health trusts has already helped them to support their obligations around patient and public involvement and service improvements. Patient opinion can really add value and sit alongside what you do already. It's not something extra, and it makes it easy for you to do what you need to do.
If the Trust and the NHS in general is really going to offer people high quality, effective and personalised care, then I think we have to listen to what people have to say about our services. And I think it is only through listening to people's experiences that we can offer the services that people need.
It's very beneficial for me because as a locality now we're getting far more feedback than we ever got, which is very beneficial for staff. Staff, you know, benefit from seeing it from the other side of the fence, as it were. So it's really beneficial. People and comments are coming through that you would never have heard years ago. It's really user-friendly. And as I say, as a manager, I get to know that nitty-gritty stuff that at times you're not able to get to that front line constantly to get that direct feedback.
The beauty of patient opinion is the range of people that it allows you to engage with. So these might be people who would not come to a focus group, who can feedback in their own homes. This allows Trust to engage with people where they are and get real-time feedback from where they want to start from.
Traditionally, we've always conducted surveys and gathered feedback in the usual way. But patient opinion is rather different to that. So it did appeal to people who like to use the internet, and it does appeal to people who perhaps don't feel that confident about leaving feedback.
Obviously, part of our role in communications is to manage the reputation of the organisation out there in the public domain, and we did have some concerns that there would be negative postings. It is very visible on the web, you know. Lots of people would be seeing bad things that potentially were damaging to the Trust, and that was a concern, and I think that was acknowledged as a concern, not just from communications but other staff too, because actually the people who do manage our reputation are our staff, our doctors and nurses that the public deal with every day. And so that concern was acknowledged. We've been absolutely delighted with the response that we've had. The postings have in the main been very positive. We have had some negative. I couldn't, you know, I wouldn't tell a lie and say that we haven't. But what we've been able to demonstrate is that we respond to those negative postings, try and seek solutions if there are problems, or reassure people if they've got concerns. And I think that demonstrates how, as an organisation, we're trying to support and help people through very difficult times.
I can read a report which gives me percentages, gives me outcomes as numbers, and they're valid, they're real. But the patient opinion information sits on top of this. It humanises it, it makes it real.
So, to conclude, patient opinion can really help Mental Health Trust to meet their commitments. It can help staff to take ownership of responding to service users, carers and patients, and also support service improvements within the trust. Of course, quality improvement strategies matter, but what also matters is how you serve your local communities.
We're making a commitment and we're being accountable for what we're doing. And I think it's a brave thing to do, but a very positive thing to do.
And I have to say I've been delighted by the response. The vast majority of the postings are really positive. The ones that are negative we've been able to pick up, take to operational managers out there in the services and actually sort of do something about it. So it's had a real impact.